Well, it was horrific, to be honest with you. Just a story from my children. They could hear me in their rooms snoring. I think they used the word freight train. And of course, I was not aware of this, but my wife certainly was. And she would tend to kick me at night, back my shoulder, and that would work for a few seconds, and pretty soon I'd start again. Fortunately for her, if she went to bed first and fell asleep, then the evening went better for her. If I was in bed first and not, it was no good for her either. So it was not a good thing. I had sleep studies taken, found out that I was getting 20 minutes a night of deep sleep, and that was it. So I was wondering to myself, how can anybody function on 20 minutes of good sound sleep? And the doctor back then, this has been years and years ago, said that about 3 or 4 o'clock in the afternoon, you probably noticed that you'd love to take a nap. Granted, I did. And later that night, I'd be tired 7:30, 8 o'clock. Back then, and as is currently, the CPAP machines, of which I'm still on. However, the sleep or the apparatus I wear as well. And what we're testing now is, can I break off of the CPAP and just use the mouth guard? And I'm going back and forth right now. And we're still in that study. The good news is that the sleep doctor who put me on the CPAP machine is all for getting me off of the CPAP to go to the apparatus. And I think that's great. It is cumbersome. It is difficult to sleep with. So I'm anxious to get off of that. Additional problem I had is I'm a grinder, and my teeth, it's a serious issue. It's something in our family. And so that apparatus not only works from a snoring standpoint, but it also works from a grinding standpoint, given the fact that it protects the teeth in that manner. I happen to have been a patient of Dr. Deldar since he came to Indianapolis. And so upon our initial visit, and of course it was just about the checkup and the teeth. And after a while we got talking about different things, and I told him about my snoring issue. And at that time he was looking into this whole apparatus and going and getting the schooling on it, and understanding how this works, and explained it to me a little more. So I felt like I was with someone who was genuine in trying to figure out how could this work. There's got to be a better way. It's all about your jaw and moving it forward and relieving the tongue that goes down into your mouth and causes the snoring. So I was open to, sure, let's look at what might be another way to do this. But please understand, you're dealing with somebody who's probably the worst snorer in the world. And so you've really got a case test going on here with me, because I think this is going to be a real issue with me. And that's when I had the CPAP already. I told him about that. And so it's been going on now for a while, and my hope is, to be relieved of that. And at first I thought it was simply, like most people tell you, well, if you're overweight, you're going to snore. Shoot, that's not true. I've seen some of the skinniest people I know and have the same problem. So it's not about weight. Weight can cause some of the issue, but it's not totally that. So I think it's a matter of, if you realize that you're snoring, or somebody says that you are, get the test study. If you seriously have sleep apnea, that could be a fatal thing, as we all learned. Sometimes you hate to admit that, you don't want to go and get these tests, but I think for your quality of life, it's important that you do. Everybody went. My energy level is back. I don't have the problem I had earlier. Now, I fear, though, one of these days, that the older I get, I'm going to need those naps regardless of what I'm wearing at night. So the age is going to catch me before the apparatus. But right now, I can stay up 11:30 midnight, still feel like, oh,